Hi, welcome to POSH Med Spa. My name is Ella Fawcett, and I'm a full practice nurse practitioner here in Fort Smith, Arkansas. Today, I'm going to teach you how to do a lip lifting technique and tinting to create a lifted, plump lip. I'm also going to show you how to do a dental block, as I get that question quite a lot. So let's dive into it and learn all the things to create the perfect pout for your patients. But before we begin, let's do a quick anatomy review today. So the things that I want you to be conscientious about is your superior and inferior labial arteries. We are going to assess the lip tissue before we get started to look for any pulsations. I will demonstrate this with the client. Next, I really want you to look at the philtrum column. We have the tubercle. We do not want to inject in the tubercle. We have the oral commissures, the vermilion border, and the cupid's bow. Let's go. So our client has had on a topical numbing, a BLT, benzocaine, lidocaine, and tetracaine. It's a 20-10-10 solution. And she's had this on for approximately 10 minutes. So I'm going to go ahead and get her cleaned, and then we're going to do an aseptic oral mouth rinse before we jump into her dental block. You're just going to do a little swish, and then you can put it back in your cup, and I'll take it from you. I have about 3 cc's of lidocaine plain 1%. I choose plain lidocaine just because the epinephrine can sometimes increase their heart rate, make them feel a little anxious. So I just go with plain personally. You can use either. All right, so you're gonna have your client, your patient, tilt her head back. So 1, 2, 3, ouch, 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 ouch. Little sting. 1, 2, 3, ouch, ouch, ouch. Little sting. Good. Okay, I'm gonna do the same thing. Good. 1, 2, 3. Ouch, 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 ouch. Good. And last poke on the upper. 1, 2, 3. Ouch, 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 ouch. Good. Perfect. And then gently massage. Just distributing that lidocaine, and you'll probably wait 3 to 5 minutes. You can ask your patient, she'll tell you, or he will tell you when they're feeling numb. They will still be able to animate, she'll still be able to talk to me. This will just allow her to be in a little less pain during her treatment today. And what I would do while getting started, and today this is what we're gonna do since we're training and we'll be talking, is I will anesthetize the upper portion of her lip and do her upper lip, and then I'll go down and do the lower mucosal block and then do the lower lip. That just gives you a little bit of time so that her lower lip is not wearing off if you're talking, if maybe you're just a little bit slower because you're just getting started. So keep that in mind. You don't have to do that, but it does give you just a little extra time. Today what we're going to do is I just want to map out a few things for you. So on her cupid's bow, the top of her cupid's bow, that's where we're going to go in with this lip lifting technique. It is a 1 injection, and we're going to lift in 3 different directions here. So you're going to start at her cupid's bow, and we're going to lift in 3 different directions. We are not injecting into the tubercle here. This is a no-no zone. After we do our lip lifting technique, then we will come in and we will do some tinting. And we'll do a horizontal V in here, I will show you, just to create a little bit more depth for her body, a little bit more structure there. So let's get started. So again, we're just cleaning. And then again, assessing any pulsations, anything that we may need to know prior to injecting her lip tissue. For safety, it's all about the depth of your needle. This is a more superficial injection. We don't want to be in the muscle of the lip, and that is what's going to keep you safe. If you are in a safe plane, there is no need for aspiration on lip filler. It would be very hard to aspirate the filler because the needles are very small. And then you will be moving quite a bit. So just really assess your plane, assess the anatomy of your patient beforehand, and you're going to do a great job and you're going to be safe. If you were to see any areas that blanched or that were white, you would stop injecting immediately and pull your emergency VO kit. This is Restylane Kiss. It is FDA approved for lip augmentation and creates a beautiful result, and it utilizes expression technology, and it is by Restylane and Galderma. So always prime my needle, bevel is up. Then I go in and I will just angle my needle slightly. Okay, so as we're getting started, always have in your non-dominant hand a piece of gauze, and then I like to start, I'm right-handed, so I will start on the left side of the patient, and I'm really assessing first their Cupid's bow, because this is the first injection that I'm going to do to help create that natural lifted result. So the patient told me before she got started, she wanted her lips to be lifted, she wanted them to be plump and more hydrated. So that is the goal of today's treatment. So we are going in right at that Cupid's bow, little poke. And we're going to lift the lip tissue up while pushing down with your right hand. So you're down. I'm keeping my finger on the wet-dry border because we do not want any filler to go in the wet-dry border. So now I'm going to start injecting as I am pulling out in retrograde fashion, and you will start to see the lip tissue fill. It's very rewarding. Okay. See that? Nice lifted. Then we're not going to come out. We're going to do the same thing. We're going to angle it to the right now. So we were central. Now we're to the right, lifting that lip tissue up. Good. And also coming down. And now we're going to the left. I'm watching my lip tissue more than I am my syringe, but I am pushing nice and slow. I used about 0.1 on that injection. So now we've done our lifting technique, and you can really see her pillow here is just so nice and lifted. Go ahead and smile for us, Crystal. See the volume, the difference in volume here. It's going to be gorgeous. She's going to love that. Now we're going to go in with our fence posts here, our vertical tinting all the way down, and let me show you how to do that now. And this is Kiss, so we are right on her vermilion border. Good. And I'm still keeping my finger here, and I'm still lifting back and down. And look, we're looking at that lip tissue, rehydrating it, plumping it. Good. And then as we're coming out, we're doing just a tiny, tiny dollop there. That helps to prevent any type of bleeding. And then also, it's a great when you're starting because you know exactly where you have been. So we'll keep going. We'll do another vertical fence post, little stick. We're looking at our depth. We can see our needle, but we cannot see the white of the needle, and that is what we're wanting. If you can see the white of the needle, the gray of the needle, you are too superficial. Okay, good, perfect. And you want to be careful not to put too much volume in this area of the lip as you're getting closer to the oral commissure. If you do that, what you'll do is you'll actually create this look where they have, and you've probably seen it before and you're like, what is that? It's overfilling in this area. So you have to be careful. You don't want to cause that to happen. Perfect. So now that we've done our tinting and we have done some vertical fence post, vertical linear injections, we're going to go and we're going to do a horizontal, I just call it a little V. And I'm going to do that right into the body of her lip. And I'll show you what I mean. Before we move on, I always like to fill of the border. I'll fill if there's any deficits that may need a little correction. I feel one slightly right here. You can also come above your client, your patient, and you can kind of see there is just a little dip right here. So I'm going to give just a little vertical fins post right here. Beautiful. Okay, let's move to the other side. So same thing, we're going to pinch, 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 pinch. We're looking for that point of her Cupid's bow here. And a little trick is if you will put your index finger and kind of push up like this, roll up, that is going to help the feeling and help your comfort as an injector throughout the process. So that's just a little trick you can do. So right into that Cupid's bow here, good. We're looking at our depth. We're holding with our left index finger and we're pulling up and pushing down with the right hand, okay? We're looking underneath here, her wet dry border, our index finger is going here, just so that we can feel to make sure that we are not putting anything in that wet dry border. We do not want to do that to the client. To your patient, you don't want to do that. And look, we're seeing it naturally fill. It looks so lovely, good. And we are repositioning now to the right, up, good. Watching that fill. Beautiful. Rehydrating that lip tissue. And then last angle here, but also avoiding the tubercle of the lip. So, good. And slowly coming up. Beautiful. After we finish the lip lifting technique for each tubercle or each pillow, I'm having the patient animate. Go ahead and smile for me. And then I'm assessing the volume of this too. So we're gonna go ahead and do our augmentation on this side with our tinting and our horizontal V's. And then we'll reassess at the very end and make sure that everything is symmetrical. Checking your depth, good. And sometimes go ahead and open just slightly, good. Just a tiny dot and following that natural border down. I am again on the left side of the patient. This is more comfortable for me. It took me years to realize that. I would go over to the other side and it would just feel uncomfortable. So it's just little tweaks as an injector that you can do that's going to make your outcomes, the feel, everything is just going to be so much more comfortable with just little tweaks. Now is the time that I come to the right side of the patient when I have finished my lifting and my tinting. And so now I'm going to go in for those horizontal V's. Again, go ahead and open just slightly. Good, we're about one little finger breadth from the oral commissure line here. I'm gonna go in, we're looking at the depth, good, and again, above and below. And so now we're doing just a slight little V here, good. And then we're going to do, and you can always measure too with your needle here. So now we're gonna go up. Second horizontal V, again, assessing the depth. You need to just back up just slightly, just like that. And we are pointing towards her Cupid's bow, above and below. Again, nice little V, do not come out. And just a little dollop there. Perfect. And my last injection point, again, is going right into her Cupid's bow. So following the natural direction of that Cupid's bow. Okay, here we are, above and below here, and giving that just a nice little push to crisp up that border. Beautiful. Okay, smile for me. Good. Go symmetrical. Smile again. Good. I feel like we may need just a slight little bit more right here, so I'm going to go back in, just last injection for her. Again, reassessing your depth. Let's give her just a slight little bit more volume right there. Okay, she's done the top. You're good. Okay, I'm gonna go ahead and numb her bottom into the mucosa, canine. And the bottom does hurt the client just a little bit more. Good. Okay, and I will start on the right side of the patient now. On opposite side, we've cleansed her and she's had a few moments to let that mucosal block kick in. So I'm really, same thing, I'm looking and I'm reassessing these pillows on the bottom to give her a nice shape. So we're gonna do the same thing on the lifting technique. We're going in, good. Go ahead and open your mouth just slightly, perfect. We're pulling up and down and then pushing down with that right hand and the needle here. So here we go. Watching that fill, so gratifying there. It's good. And then same thing, now we're going in towards the right, watching that fill, so satisfying. And something here. I'm holding that left tissue. And sometimes I'll just right here on the border, I'll do just a little bit more. And just a tiny dot. And it's very slow and precise. Don't have to go too fast, you do not have to rush it. Okay, and now we can see that we have pulled this lip tissue down just a little bit and helped to revolumize that pillow. So we'll go on and do our tinting now. Good, watching your depth. Out, good. Same thing, watching your depth. Coming out. Good. Perfect. And then I'm gonna go to the side and we're gonna do that horizontal. So again, 1 finger breath here, going in, checking your depth. Always reposition if you need to. And then we got our little V right there. Beautiful, good. And then now you're measuring, you're going in for your second V. Good. Too deep. You don't want to be under that muscle. Good. Beautiful. For comfort from the injector perspective, I like to stay on this side and turn the patient's head towards me. And I'm going to go in to do her next pillow for the lip lifting portion. I'm not injecting right here just for now. I will come back at the very end and reassess this middle area of her lip. Okay, so let's go ahead and work on this pillow. Same thing. Good. Watching our depth and up and down and pushing down with that right hand. Okay. Slowly pushing, we're watching that lip fill, so nice. Repositioning to the right, up and down, good. Keeping an eye on your wet dry border. And repositioning here, up and down. And watching that lip tissue expand. Good, perfect. Coming into our tinting. Good. Nice and slow. Good. You also want to be sure to ask your patients if they have a history of cold sores. If they do, you will need to prescribe some Valtrex, 1 gram twice a day for 7 to 10 days. Go ahead and open for me. Good. Going in for that first horizontal V, up and below, nice and slow. Good. And insertion point. And again, my needle is angled on the bottom lip as well. Beautiful. Okay, so let's reassess the central portion of her lip. So I went to her left side as I was doing her horizontal V's, and then I'm back on this side as just a preference because I'm right-handed. And then I'm going to go in And just make sure that we have a little bit of volume here in the central portion of her lip. Good. Good, checking your depth. Beautiful. Smile for us. Good. And assessing symmetry, assessing cap refill. Everything is looking nice and pink. At the very end, I am going to work on her vermilion straighten. Last injection here. I'm kind of pushing down, really just helping that border of her lip. And we'll do one more on the other side and we'll be done. This isn't something you have to do on every patient. However, with her lip anatomy, I think it would be very beautiful. And so we're just crisping up her border centrally. Beautiful. Okay, let me show you what to do for your pictures. So we're just cleaning the area off. I use a damp piece of gauze for this one, and then I'll go in with a dry. And you may have just a few little areas that you need to clean on your patient. So post-care, they want to keep them hydrated. I also tell the clients they cannot use them for about 3 weeks. And if they had any areas that were white, blanched, any areas of concern, I'd want them to contact me, and you'll want to educate your clients on that too for safety. Usually if you did have a VO, you'd notice it right away in the chair, but not always. So it's something that you are conscientious about. Don't scare your client, but just give them good safety measures to be on the lookout for. And then I like to see them in 2 weeks, just to make sure they love their results. So at the end, I'm putting just a little bit of Neosporin. It's just a preference. Everyone has their own. I like to do this. It's really beautiful for your pictures. It provides the prettiest gloss. And then just cleaning up. And then lastly, let's do the big reveal for our patient.
Oh my gosh. I like them. Love them.
So juicy. So she'll be a little numb for probably about 15 to 20 more minutes, and then that dental block will wear off. And that's a wrap. Now you know the lip lifting technique, how to tint, and how to create a beautiful, plump, lifted lip for your patients. And if you're interested in more training opportunities, we do have a training academy called POSH Prodigy Training Academy. If you're interested, just reach out to Ella at poshfortsmith.com. That's POSHFORTSMITH.com. See you soon.